Good day, I am Jasmine Carlin Emmalunas, a first-year nursing student. As I learned in our health education, I came up to this idea entitled A Healthcare Settings in Dolores, Quezon. In my community, there are no healthcare places that are always available and can easily go on to it because there are no nurses or attendees. So as I planned it, this will be good to enhance and strengthen the healthcare settings for the people who need it. So let's proceed to the rationale. The purpose is to facilitate more healthcare settings and help the community by sustaining or giving knowledge about the healthcare settings, like where they will go if their family got sick. The residents can identify the healthcare settings and can communicate in the nurses in charge, where they can ask for help, such as asking right medications that are prescribed to them. So it will benefit to the students like me and the whole community to have healthcare facilities that provide efficient care without going to other cities. So the healthcare settings are freely accessible to the whole community and shall be under the government's supervision to ensure safety. So let's proceed to the objectives. So the first objective is to inform and know by the community the use of health settings.
So it is where they should be familiarized where the health settings is located, and this is where the presenters discuss the use of facilities.
So the next is to understand the essence of health to us and to environment.
So it is where they understand the importance of health in the environment. So the discussion is all about the diseases that we may attain or get in the environment.
The next is to increase the availability of healthcare settings in different barangays.
So in this, it is where we coordinate with the government to enhance our infrastructure and give us more nurses so that the people have availability to access more the healthcare.
So let's proceed to the background of the study. So the Healthy Settings movement came out of the WHO Health for All strategy in 1980. The idea has been refined over the years by calling for the creation of supportive environments with a focus on settings for health and emphasizing the value of settings for implementing comprehensive strategies and providing an infrastructure for health promotion. So at the most recent global conference on health promotion in 2016, the Shanghai Declaration further expanded the role of health promotion in achieving the Sustainable Development Goals, or the SDGs. So at present, various settings are used to facilitate the improvement of public health throughout the world, such as cities, islands, workplaces, schools, communities, families, and markets. So the World Health Organization defines settings-based approaches to health promotion as those that involve a holistic and multidisciplinary method which integrates action across risk factors. So the goal is to maximize diseases prevention via a whole system approach. So the settings approach has a roots in the WHO Health for All strategy, and more specifically the Ottawa Charter for Health Promotion. So healthy settings, key principles include community, participation, partnership, empowerment, and equity. According to the WHO Health Promotion Glossary, a setting for health is a place or social context in which people engage in daily activities in which environmental, organizational, and personal factors interact to affect their health and well-being. So these settings are often called places where people live, learn, work, or play. So settings can also be used to promote health as they are vehicles to reach individuals, to gain access to services, and to synergistically bring together the interactions throughout the wider community. So, according to Poland and others, he addressed this by providing a framework for planning and delivering multiple interventions in settings that are aimed at the whole setting or underlying condition. So let's proceed to the process. So this is the healthcare settings process. So the first is by spreading the information. So in this step, the student must do a infographic or flyers to spread information about the program. They can also choose on their preferences whether it is physical or online webinar. So it is conducted through online survey and census. So the next is to classify the participants. So this is where we classify the participants, either a young adult or elderly. So it should be distinguished so we can talk appropriate manner to the audiences. So the next or the third step is to schedule the webinar or the seminar. So it is where the seminar will be held in the time preferred by the participants. It is also where the students will place the location to held or to be held the program. So the fourth step is gaining knowledge about the facilities. So it is where the seminar occurs in which the speaker explains the importance and information of healthcare settings. So it includes who will they contact and where they will go if there is an emergency situation or one of their family gets sick. So the next step or last step is to employing the community and its effectiveness. So this is where we observe the effectiveness of the seminar and how does it affect on the daily lives of the residents. So it is either they will ask for our help or not. So this is where we evaluate if the seminar or the webinar is effective. So let's proceed to the benefits. So the first is the community will have a background knowledge about where the healthcare facilities are located. So the next is the community or the residents can easily access the settings through maximizing the space or building for healthcare in various barangays. The next is the healthcare settings can prevent the infection in the community. This infection can be get in our environment, so such as dengue or leptospirosis and others. So next is let's reflect. So the healthcare settings is vital to the community as it provides health prevention to its subordinates. So the mission of this study is to inform all the residents that consoling their health status is a must. So on this, residents can acquire knowledge and skills from their community to prevent the spreading of diseases. So next are the resources. So it is from the healthy settings and from WHO in Western Pacific, the activities creating health promoting settings. So that's all. Thank you. I hope you learn and listen well in my presentation about the healthcare settings in Dolores Quezon.
So once again, I am Jasmine Carlin Emil Lunas and thank you for listening.